Thanks everybody for coming. You'll be remembered forevermore that you came to the strategy launch. You know me, I'm Colette, CEO of UL Hospitals Group. Just on your seat or on the way in, actually at the door, you'd see a feedback card. It's important to get feedback at how these communication roadshows are ran, so it'd be good to get your feedback if you could fill them out. And also, there's a tiny little QR code that you can take with you, and you can actually, like the days of COVID, you can download the strategy onto your phone if that's what you like. Some people like hard copies. Okay, is that all right with everyone? Okay, great. Okay, so you're welcome today to the launch of our new strategy, 2023 to 2027. And this strategy, as you know, will embody the direction of UL Hospitals Group, where we're going, what's our true north, what are the plans, what are the priorities, and no matter what you're developing in your services or business cases you're developing, you'd write it in alignment with the strategy document. Equally, if you're writing a strategy or an operational plan for your service area, again, you'd align it to the strategic document. So it's important to have a copy of it handy so you know the direction of UL Hospitals Group. And I am confident that we will deliver improvements to the health services of the Midwest by implementing this strategic plan, just like our last strategic plan. And some of you, I've given you a little copy there of the achievements of the last strategic plan, despite all of the adversity, the pressure on the system, the demands, COVID-19, cyber attacks, and I could list on forever and ever. But it's nice to look and see, because those achievements that set out by the hospital group were delivered by you and all of your teams and all of the departments. So very well done, and that is important to have it. It's also a useful document to have under your arm if you're going into an interview, but in the hospital group or outside of it, because it's written in such a way that it will take cognizance of health regions, how they'll be developed, and the future direction of that. So it's an important document to have for those interview processes. Is that okay? Everyone's still with me? That's that. So this is just a little snapshot video that'll just give you a snapshot of the strategy, then I'll get into more detail with you. Okay? Okay, so the video is very helpful. It just gives you a whistle stop off the strategy. That'll be shared, that link to the video, to
sites.
Yeah, so we've launched at NE now. We're just covering all the sites over the next week. Then I'd expect you as managers to show that to your staff so they know the direction. Most people say, what strategy got to do with me? But it has everything to do with how the hospital group will go forward into the future, and all of the operational work behind that that'll make it happen. Okay. So our vision and values in this strategy, you'll note in the last one, it was different, and we've changed it slightly because we're evolving as a hospital group over many years, and really our view of this strategy is to promote a culture dedicated to the delivery of quality and safe patient care. And if we get that right, everything else will just fall out of it. And we can only do that as staff members through care, compassion, trust and learning, of course. So that is the headline vision and values of the group that I'd like you to embody in the works across your units. There's 4 priorities, so it's easy to remember that, not 24. 4 priorities with 5 enablers. And the first priority we felt after all of the workshops and engagement had to be patient experience and public engagement, because we have a lot of patients that come through the hospital group, and indeed a lot of public opinion on how the hospital group functions. And in the main, it's 90% very good. And then we have our other issues to deal with around access. People, performance and culture is another strategic priority, and that's for yourselves to be looking at. How you develop under performance achievement, what are you delivering in a performance cycle, how you interact with your staff, what is the culture of your unit, the culture of the hospital, how do we ensure that we have good morale and good standards. And then the third is the academic health science system, which I'll talk to in a moment, that has been evolving over the last few years, but we've now made it an absolute priority in this strategy. And then integrated care systems, which is something, of course, where we're heading with the health region model that's about to be enacted from next year. So there are 4 priorities, so try to remember those. The 5 enablers, that's what will actually make it happen for us, is operational excellence and excellence in what we do, our financial resilience to deliver that, our strategic transformation office, which is now set up and running, that will stream all quality improvement, look at our use of data and one source of truth, our digital excellence, which is a real area of focus that we have to improve on, and then effective communications, because of course if you don't communicate the plan, people don't know what direction to take. So I just want to thank the comms team for all their work on this document, all the work on the videography, and all the work that will precede that into the future in delivering this. So look out for the various newsletters, the staff app, because you get lots of information on that as well. So if we talk about strategic priority 1, patient experience and public engagement, of course we want to make sure we're a welcoming and an open place for all people, that we build and maintain trust so that patients have a positive experience. And we have identified several initiatives that we can ensure that we've honest and clear communication with our patients and public. And then we want to increase opportunities for patient involvement in decisions about healthcare provision, so that we can have a trusted relationship and that we're committed to strengthening that with the people of the Midwest, not just inside the walls of hospitals. So how do we do all that? Well, an open and just culture is a very good start. That it'll help us develop and maintain that trust with patients, even if things go wrong, so that we're open, honest and just about that. The patient experience, do we test and measure it? So how do we understand the true experience, other than getting lots of really nice compliments and then some very not nice complaints? But there's a lot more experience that we're not capturing or hearing about. Patient activation is about self-management, teaching patients to look after themselves, increasing an activation around their chronic disease, the knowledge and skills and confidence a person might have to manage their own health. And we have a lot of very good practitioners in the service who do this day in, day out, but we need to activate it more. And then public engagement and involvement with them. And to do that, we really need to push forward and partner with the public and the patients to deliver person-centred care, and really reaching out to work with the public rather than them just reading headlines about UL Hospitals Group. So a proactive approach to that. So some of the initiatives we hope to put in place over the next 5 years is firstly to develop a patient engagement strategy. So how are we going to go about these surveys? and also develop out of that a patient experience framework that's based on patient stories. It's not our stories, patient stories. Then to collaborate with patients to co-design services in the UL Healthcare Network. What is the UL Healthcare Network, one would ask? Well, it's the universities, it's industry, it's ourselves, it's the community. So how are we going to work with patients to co-design what they need? And a lot of that will be driven now in the health regions based on population health. So what's the needs of the Midwest? What services should we be trying to get up and running over the next 5 years? And there's a lot of information on that as well. Then how do we actually develop a patient engagement approach? Well, we'll use a survey model to see how we go about that. Health promotion. So we're in the business of health, but a lot of it is prevention, that we're reacting to illness, but how do we actually promote it further so patients are activated to self-care? We want to expand our patient council that has done really good work over the years, but requires further expansion so that they can work with us and become more visible to everybody. And set up, which is really important to me, a Midwest Citizens Panel, so that we are really engaging with the public outside of these walls to see how we can work closer with them, as I said, to develop a service that is exemplar and addresses their needs. So that's easy, isn't it? Will you remember all that for your interview? So at least you have books on it there. So strategic priority number 2 is people, performance and culture. We want to be an attractive place to work where you feel recognised as staff members and equally supported to the best of our ability. And we'd like to be recognised as an employer of choice, both locally, nationally and internationally. And here's the little secret, we are recognised as an employer of choice, with staff coming to work here after going through their training from all over wanting to work in the Midwest region. It's not just the hospital values, but it's the area, of course. The Midwest is a nice area to live in and work in. But we want to ensure that people we hire are the best talent and to support them and our current staff so that we can grow them to the levels that we want to run an acute hospitals group. We will have to ensure that there's access to training and further development opportunities for our staff so they can be exemplar. And you see that when you walk the units. I see it in my 9 years, all the staff that have developed and got promoted because of their hard work and development over the years. And we'd like a more transparent, of course, and inclusive culture amongst our staff, which is really important to us, that we have a lot of diversity working in that hospital group and every person counts. So, areas to look at, what does it mean for us? Well, we definitely need to further develop our integrated workforce and support that diverse but and also inclusive culture within the service. A purpose-driven organisation will make sure there's a more positive environment for staff and improved experiences for patients. And I've always said happy staff equals happy patients. And to support staff in their professional development and ensure that they can develop in the areas that they're interested in working in. High-performing teams, of course. It's important to have a performance achievement and ensure professional progression. We have to ensure that all of our staff have continuous learning and that their leadership capabilities are brought to the fore and that they're nurtured and that the diamonds are found, because there's lots of diamonds in the service to develop into leadership capabilities. And then a free flow of information, across the services, acknowledging diversity of our staff and their belief systems so that we ensure that we are inclusive and that we're cognizant of different beliefs that we work with across the services. So some of our initiatives over the next 5 years under strategic priority 2 is to streamline firstly the induction processes for new staff, to make it so much easier and that they get inducted a lot quicker into the service. We want to put in place a new recruitment model, and some extensive work happened over the last strategy with at least digital online applications, even though people tell me they can be tough. But equally now we're moving into where you can sign all your contracts online, so it speeds up the process of recruitment. We have to look at our strategic workforce and staff retention plan. So when you drive up, you see the 96-bed block being built. That requires a strategic workforce plan as to how we're going to develop those services, what those bed blocks will look like across our hospital group, and how we'll develop the workforce for the new theatres in Ennis, for example, ambulatory gynae in Nina, and all of the other developments across the system. And then we need to develop an education training model, not just going to college and doing your masters and postgrad work, which is really important, but actually what do we need to do in-house to develop and train our staff, and that it's linked very closely to the academic health science system, which I'll talk about in a moment. We need to expand the health and wellbeing facilities for staff. Probably the most positive feedback is the health and wellbeing facilities, but we need to grow it across the group so we can help our staff come to work and deal with all the other adversities or tragedies or whatever else is going on in their lives, that they're able to be supported when they're in the workplace. We also want to develop a diversity, equality, inclusion plan, as mentioned earlier. And then also very important one to keep on your radar is our sustainability campaign. So all the young people of the world are talking about climate change and net carbon zero emissions. What are we doing about it? We're the biggest employer in the Midwest region. We have to really get behind that and start working on our climate action plan. And some good work has started, but you'll hear an awful lot more about that in this current strategy. The academic health science system then is our strategic priority number 3. And the academic health science system exists already in the UL Hospitals Group, and the Centre for it exists here in the CERC actually, and it's ably led by Professor Paul Burke and a team of people. And really what academic health science system is, it's like a 3-legged stool. Area that you have to work on is your clinical excellence. So we have a lot of clinical excellence in service, but also alongside a very skilled, qualified person, there has to be a culture of learning. So what's your ongoing learning to deal with what the needs of the region are? And all of that learning and your excellence has to translate into research and innovation. So if you're not doing your research, especially in areas of advanced practice, and innovating in areas, you know, across the sector, from every sector in our group, you can innovate and come up with ideas for quality improvement. Well, then you can imagine a 3-legged stool without a leg. It just won't work and it'll fall away. So there'll be a focused approach in that, because we've been working on this system for many years. We've now made it a front and centre strategic priority to drive forward the Midwest. And what happens out of research and innovation and developments like that is it attracts more people. So they want to work in that environment, because quality improvement leads to patient safety, leads to good outcomes, and it leads to staff who are extremely qualified and expert in their roles. So we definitely, I've spoke a lot about the research and innovation, but you look at service delivery. So if you go across the system, you can pick many departments and see where service delivery has led to innovation, and even the works around patient flow, the developments, it's a constant cycle of improvement, the developments with the community, how we're going to set up services, all linked into service delivery. So we promote our clinical excellence through enhanced teaching, training and simulation, of course. So I'm sure you know we relaunched the simulation centre here in the CERC a few weeks ago, and it'll be a multidisciplinary approach. And simulation actually prevents adverse events because people work together in teams, and it's well documented. So it's important that we promote that clinical excellence. It'll also drive innovation outside of the hospital group. So we work with the Rapid Innovation Unit in the University of Limerick. Some of you are in the University of Limerick talking to students, lecturing students, assistant students. All of that's innovative practice, learning new management skills, new expertise, and then we're building as well. So we're dealing with the research around SARI guidelines, so single room facilities and the knock-on effect of that. So what we build even requires research and innovation and how we make that work. All right. So the next 5 years, some of the initiatives we're going to start is set out the governance structures and the leadership for the academic health science. We'll also implement the new National Research Governance Framework document, which you can download. The Rapid Innovation Unit and initiatives such as the Winter Education Series that we do for the public and the GPs will be evolved further. Rapid Innovation, an example of that would have been during COVID. I don't know if you recall, with the ventilated patients, where the Rapid Innovation Unit came in and developed a system where the patient could be enclosed while the staff were dealing with intubation. That was the work of the Rapid Innovation Unit. They're also doing work in St. John's, so just to be aware of that. A hospital health science campus is important, and that model of a hospital street has to be evolved. And what is that about? Well, you look at how big UHL has become, how much the Model 2 hospitals are embedded and receiving really high standard HICWA reports, and we know the service is really floating well. But a hospital street would embody the industry factor, the university, it would involve the development of the community health organisations, and all interlinked, helping the demographic profile of the region. So it's a health region. Think of that. Okay. A creative life and health promotion centre is a novel one that we're thinking of really developing as an initiative, and I think that is where it will really help patients. If we can help them self-manage, such as the chronic disease, pulmonary disease patient, that they take their steroid inhaler at the right time so they don't have to come into ED and wait on a trolley for 48 hours. And all of that development is really an area of focus that we'll be working with you all on and taking guidance on. And then setting up a technology transfer office is important to us. So what's a TTO? Well, we do a lot of research in this hospital group, and you'll read about it in lots of places. And out of that comes a lot of spin-offs, especially through the university. And out of that comes a lot of money. And we are the lab. The hospital group is the reference lab for all of that great work. But surely some of that funding should come back in to the service where the people delivered and supported the research so that we can develop further. So we plan to set up the technology transfer office. Okay. And then the strategic priority number 4 is, of course, the integrated care system. So I think if I asked anybody what that was, I think you'd all be able to give a version to me anyway. But of course, it's all about one system, one budget. Our patient doesn't come in this door, get treated and go out and have to go in a different door to start a different treatment plan. It should be seamless. So they should be moving across the hospital, community, ambulance services, one person, one disease. And that is really important, is that we develop that in our catchment area, and we'll be going forward, we'll be known as HSE Midwest. Let's be aware of that. That's in line with the Sláinte Care model of care. We have identified a number of initiatives that will support the existing integrated services, and there are quite a few, but we also want to develop new ones. All of that, of course, integrated care, is closely linked to the academic health science system, because of course the research and the innovation behind that will promote really high quality healthcare and continual improvements to service delivery in the Midwest. So it's high level but really important. If you know your 4 strategic priorities overall for a catchment area of 410,000 people, which I'll show you in a moment, and 6,000 headcount of staff, if you know your priorities, out of that falls all of the important work that you do every day. So, just on the integrated system, I did mention the health regions, which is HSE Midwest. I talked about same quality care, health equity. It doesn't matter who you are, where you come from, it's the same level of care. And you'll notice since last year the public only contract for consultants, so it's public only, no matter who applies for a job in any of the hospitals in Ireland, it's a public only contract. So the system will look after the patients that come in the door, no matter whom you are or where you come from. Okay. So what are we going to do about integrated care over the next 5 years? I've mentioned some of them there, you can have a look at them, but the enhanced community care model is an area of focus. We've been working on the enhanced community care services for the last 2 years now. So an example of enhanced community care would be ICPOP. You aware of ICPOP? Community intervention teams. How can we help our public to attend the community services that's available to them before they come in the door of the emergency department? Because for all of their life, their first point of contact was where? The emergency department. And that's in our numbers, it shows it there. So that enhanced community care model, so my mother in her 80s can go to a community care network, she can have her assessment done for frailty, she can get advice on her COPD, she can get a chest x-ray, she can get a CIT to come in and give her the antibiotics because she's pneumonia. I'm making all this up, but she does exist with other problems. But all of that, and she never once has to go into the emergency department and lie in a trolley for 2 days. And that's where it's a key focus of ours. So that bi-directional flow, and of course then, they come in if they're sick and they need acute care. Of course they do, and we treat them. And the other one that staff talk about a lot is the electronic healthcare record, which is the bane of everybody's life. And it's a massive, as I've said, at many roadshows, billions of euro to get that up and running across the country. So an instruction is issued from the CEO of the HSE that the first area of focus would be the shared care record. And all that work has commenced already nationally. And that means that your record will travel with you, at least. It's a start. It's not everything and anything, but it's a start. So the GP, the community network, ourselves know when you visited either of us and what treatment you got. And that's a really important start, I think, and there'll be investment in that. Okay. So there's key activities that we need to hit the ground on because it's now, is it October already? So 23. We've been working behind the scenes on a lot of it, but that really have to get going in the end of this year and into next year in the main to develop the patient engagement strategy and begin the expansion of the patient councils, which I have commenced and I've realigned the terms of reference in the last week, and then the patient experience framework. So those three are three big ticket items that become our baseline to deliver on our strategic plan. Then we have to promote the high performance. So there's good work in that area with PDPs, the development staff, plan of actions, performance achievement, but that's all just the normal structural governance of performance, but actually high performing teams through simulation at ward level, the standards of care you deliver, no matter who you are and where you are. The continuous improvement culture. So instead of defensiveness, we're going to say, yes, we got that wrong. How do we improve it? What's the cycle of improvement? We're a lot of people well trained in PDSA. How do we actually continually improve and not make it, an issue? Make it more a learning, which is really important. We will be doing a health and wellbeing survey because we've exercised you all to death. Now we want to know what else we need to do. There's lots going on in health and wellbeing. It's a big realm and it's an important realm, but it's to see what more you need. And one of the big areas a lot of staff talk about is the blended working. And that policy, I think, landed in the last week or two, just giving direction where we're going to start. We start small and see how that works for some staff. I know not all staff can do it, but it'll be based on the exigencies of the service. But we do want to roll it out, so we are promoting that. Establishing the academic health science system. So again, we start to deploy research and evidence implementation training. What does that mean? So first of all, we had to do a review of what research is out there, and believe me, there's a lot of research being done, but is it just done and left to one side, or can we actually use it to do quality improvement? So we need to train staff on that, how we do actually theory to practice, I call it, and actually ensure that the research we do and that we fund and support actually makes a difference to the front line and to patients. And then I've talked about the implementation of the health region. There's a new regional executive officer post coming in the coming months. From February next year, we will still exist as a hospital group because we have a lot of work to do. It's a massive change management project. But there will be shifts to one budget, one system. So instead of bidding to the community or bidding to UL hospitals, it'll be one budget holder. And that's €1 billion. So that's a lot of money in the Midwest. So changing times, but you just continue to work and deliver for our patients is my advice to you. The 5 enablers I've gone through with you, I think it's pretty clear to you how they actually support us to achieve our priorities, and they'll interact at times. Sometimes you'll need all 5, other times you'll just need 1, but the enablers are important to get those 4 priorities moving. The good news is we have till 2027, so we don't have to start running now to deliver all 4 at once. Okay. So the demands of a growing Midwest region, well, a growing hospital group as well, as I've said, there's 410,000 people that was served in 2022 as per the health census, or as per the overall census. And that showed that we had a 6% growth in population. So people do want to live in the Midwest. And 1/3 of that were under 24. So that tells us we should be educating them for the future and trying to tackle that group So yes, we want to abolish vaping, don't we? Yes, things like that, so it's health prevention with them. But it's interesting that 1/3 are under 24. The growth can be set out in certain ways. Why did it grow to such a level? Well, there was a natural increase, and then there was migration as well. And we've had a number of Ukrainian people coming to live in the region as well. The death rate from 2016 to 2022 was higher than the national average. And the Midwest has the second highest prevalence of long-standing conditions in Ireland, with 22% of the people having some form of disability. So you can feel that on the ground coming into the service. 80%, however, perceive that their health is good or very good. Housing is the key challenge for the region, like many others. And then we have the unique profile in the Midwest of having only one emergency department that's serving that catchment area, and we're underserviced by private hospital access. So you put all that together, you'll say that's why our ED is very full. So what do we do about it? Do we spend because I know everyone's worn out and it's only October, do we spend the rest of our lives tackling the same problem over and over? What did Einstein say? Form of insanity, isn't it? Doing the same thing over and over. So we have to come at this a different way. And through the strategic plan, we will be looking at health regions, the management of patients, the Citizens Bureau, the health prevention and promotion, and the health and well-being of our staff. And we might have some hope of actually managing the demand on ED. And alongside that, we're building beds, but it takes a while to get beds up and running, as you know, and it's not an easy task. So I would like you to take the strategy and be proud of it, because it's the work of all the workshops. It's your strategy, it's not mine. It's your Northern Star. It's the direction the UL Hospitals Group is going in, and embody it in everything that you do. And we'll all work together, and you'll hear about it at Roadshows, what we're trying to develop into the future. And I thank you for coming, because I know it's busy, but it's important to have people here. So if you could, you talk about it, talk to your people, show them the QR code, and let them familiarise themselves with even a priority they like, and see can they drive that in their department. Thanks very much. I'll take questions after. And I have some hard copies, because people like hard copies sometimes, if you want one. Okay. Any questions for me? You may not, you might have to digest it first. Isn't that it?
We have some questions because there's people online.
Oh yeah, I should have said that. There's people also watching.
Yeah, so there's the question is, as we're moving into HSE Midwest region next year, how will the strategy fit into the strategy for the region?
Very good question. And when we were writing the strategy, the executive spent a lot of time talking about what would that look like before the workshop started. So the strategy, when you read it, is written in the hand of being a health region. So it's very broad scope. We couldn't say the health region strategy, because that would be unfair, because it means we were taking over the world. But it's written in the way that it could be a health region strategy. And I've discussed that with the CEO of the HSE at the time. And that's why I cannot work in a system if I don't have strategic direction. There's no point in me being here. So that's why we carried on to develop it, because as health regions evolve, take a number of years, and we probably, by the time it's embedded, we'll be on our next strategy.
Just one more question then about what does a Midwest Citizens panel look like?
Yeah, that's a good question as well, and we're only starting to develop it. But it's not just patients, it's public. So our patient council represents patients, they support us in lots of things that we do. They sit in a lot of committees, you probably met them over time, but you'll meet a lot more of them. But the citizens panel is about us going out to test the system, test the Midwest on their views, where do they think we're going wrong, and actually listen, like a listening forum as well. And some of the stuff, we'll be able to explain it better, so they have a better understanding of why we function the way we do, our complexities, and equally then we can take on board some of their views of service delivery. And also a small nugget that we were trying to do over the last few years is working with socially deprived persons, how they're educated, that they know about their health, how we can promote that with them. Mental health is another area, huge focus, and indeed alcohol recovery units and how we support people and vaping, which is a pet of mine.
One more question that's coming in online, just in relation to the patient council. How are you going to go about expanding that?
Yeah, so we actually advertise for volunteers. The patient council is a voluntary service, and so we'll advertise and interview informally, obviously, the people for it. And what we try to do with the patient council is that we have all counties represented, and when they're elected as members, they take a special interest in the area they come from. For example, North Tipperary, Clare, Limerick, and they become buddies to that hospital. And that's the service we want to develop. I'm also expanding the council to include some more executives, because I interact with the chairman, who gives me a twice yearly report on the activities of the council. So it's important that he has more support. Some have retired, so we want to build a bigger council, not just tokenism, if I can say that in a nice way, but that they just don't sit on committees and try to understand us, but actually they can be mystery shoppers and have a real impact on the development of services. So that has to expand, and that's how we do it.
Yeah, that's the last question.
Any other questions? Okay, folks, you're free to go then. If that's it. Do you want a copy of the strategy? Come up to me if you do.